Welcome back to the Invisible Strength podcast. As part of our expert series, today, Chris and I are welcoming industry expert Dr. David Clarke. With a background in psychology and medicine, he has spent decades helping patients uncover hidden sources of chronic pain. His work highlights how stress and trauma manifest in the body and the practical ways people can address these challenges using safe, affordable, and science-backed methods. Dr. Clarke, we are very thrilled to have you here today. Thank you for joining us.
Great to be with you. Thank you for sharing these ideas with your audience.
You have an extensive background. I know you could do a better job of, rather than me trying to share what all that you do.
Yeah, I was very traditionally trained, and organs and structures were considered to be pretty much the sole cause of pain and illness in people. And I did very well in that world. And the first 7 years, that was essentially the focus of everything I was learning. So the last thing I expected was to encounter a patient that I didn't know the first thing about diagnosing or treating. And this happened, it's a little embarrassing to admit this as a physician, but I got into the 8th year of my formal training before I found out that the brain could cause real physical symptoms in the body, even when there was nothing physically wrong. This was a woman who was in her late 30s and for 2 years had been having severe constipation. She was averaging 1 bowel movement per month despite taking 4 different laxatives at double the recommended doses. And she had already been thoroughly evaluated at another university. She was referred to my department at UCLA because we did some specialized testing. That test was normal also, so it was left to me to essentially do her exit interview and tell her she was going to have to live with this. But I didn't want the conversation to be over in 30 seconds, so we kept talking, and eventually she trusted me enough to tell me that she had been severely abused as a girl. Her father had molested her repeatedly. And that was, stopped happening 25 years in the past, so I didn't think it was relevant to her condition, but it gave me a reason to have her see a psychiatrist who was very experienced in physical symptoms as well. The psychiatrist was certified in internal medicine. Her name was Harriet Kaplan. And I thought, maybe Harriet can help this patient live with her condition a little better. But it turned out when I ran into Harriet 3 months later in an elevator, and this was the elevator ride that changed my career, because between the ground floor and the 5th floor, Harriet told me she had cured this patient with about 10 weeks of counseling sessions, meeting once a week. And that just shocked me. The idea that you could alleviate a serious physical condition just by talking to somebody. Nobody had ever mentioned that such a thing was even possible, let alone to see it actually happen. So I thought, if I want to be a complete doctor, I should learn how to do this. It might come in handy from time to time. So I had Harriet teach me her basic framework over the next year and a half of my training. But when I got into private practice in Portland, Oregon, there weren't any Harriet Kaplans up here. And I quickly found that whenever I had a patient whose diagnostic tests were normal and didn't show any organ disease or structural damage to explain their symptoms, I would start asking the questions that Harriet had taught me. And I was suddenly finding 5 or 6 patients a week that had these brain to body conditions. And their normal mental health approach of cognitive behavioral therapy turned out not to be successful for these patients. And many of them come back to see me and say, I've still got my condition. Now what do we do? And I began trying to help them. And now it's 40 years later, and I've successfully diagnosed and treated over 7,000 of these patients and begun teaching it all over the world, essentially.
That is remarkable. I'm thinking about the people who have such unresolved trauma. I was sharing a story earlier this week about a great aunt of mine who's passed away now, and we were having lunch one day, and I said, Auntie, you should let me write like a story about you. I should let me write like a memoir or something. Like you have such great stories. And she paused and said, no, I can't tell these stories to everyone, and just literally like died with those stories inside of her. And I just think about the ways in which trauma can manifest itself in this physical way that you're describing. What sort of skepticism have you encountered as you're explaining this to those inside of the medical field, those who are outside of it, who are like how can the brain affect the body? What sort of skepticism do you encounter?
Yeah, well, I was skeptical myself when I
Mhm,
started. I mean, how often does this happen? Can people really get these conditions just from the brain? But the more patients I saw, you couldn't deny that this was actually happening, that these symptoms are real. They're not quote unquote in people's heads. They happen to people who are actually mentally stronger than average. They're
mhm.
carrying loads of stress that would bring any of us to our knees
Yeah.
physically. So yeah, that's absolutely real. And the physicians that I worked with, they saw the results. I mean, I was alleviating symptoms that were not improving with traditional medical treatment just by going after the real cause. And the
Mhm.
severity of this, one of my patients was ill for 79 years, and another one I was asked to see on her 70th day in the hospital. This was a 17-year-old girl with unexplained abdominal pain for 2 years. She'd already seen 6 other gastroenterologists, which is my specialty, and she was getting morphine around the clock in massive doses. But
Mm.
she also was successfully treated. Another patient had a completely paralyzed stomach, which meaning the organ of digestion, not the abdomen. It was
Yeah.
completely paralyzed, a condition called gastroparesis. Again, completely from stress, because when we uncovered the issue in his life that was causing this, it went away. So when my fellow doctors saw this and saw that it could be treated by going after the psychosocial causes, they loved it. They were sending me, lots and lots of referrals. I received the Doctor of the Year award from the very
Mhm.
large organization that I was working with. My colleagues in the GI department were asking me to do 90% of the second opinions for the entire department. So, once people see the results from this, they love it. There was a group of doctors in a medium-sized city on the East Coast that took the courses we have on symptomatic.me and started applying it in their practice.
Mhm.
Absolutely transformed how they were practicing. This is 40% of people that go to see a primary care doctor have
Wow.
these what we call neuroplastic or brain to body conditions. And before they took these courses, they didn't really know what to do for these patients, and they were very frustrated, both the patients and the doctors. But once they learned what to look for, the patients were getting better. It became very rewarding for the doctors. One of them took me aside at a conference and said these ideas had put the joy back into my work.
Yeah.
It was really nice to hear.
Dr. Clarke, you had brought up how a lot of times they just think it's, well, not just, but stress related. It's all in your head. Oftentimes, in before diagnosis with autoimmune conditions, as you're aware, they can
Mhm.
be hard diseases to diagnose. How do we bridge the gap between figuring out if it's in our head stress related versus an underlying condition going on?
Yeah, it can be a real challenge because it is entirely possible to have an autoimmune condition and a neuroplastic brain to body condition at the same time. Chronic pain, for example, can certainly be entirely from an autoimmune condition, rheumatoid arthritis, for example. But you can also have rheumatoid arthritis with a component of the pain coming from a brain to body or neuroplastic condition. So your very good question is, how do we sort this out? And my approach is to assess the person for psychosocial stresses in their life that might be contributing to this, whether it's in the present day or whether they went through something as kids that they would never want for a child of their own. Other clues from this are that symptoms that move from place to place are much more likely to be neuroplastic than autoimmune. Symptoms that are multiple in terms of their body location or their quality or the number of different organs that are involved. Those are often more often neuroplastic than autoimmune, even though autoimmune conditions are capable of affecting the entire body. If you have symptoms that are in more than one location, and the more symptoms you have, the more likely it is that neuroplastic processes should, at the very least, be assessed for, looking for these past and present stresses. Symptoms that are not triggered by the same thing all the time, not consistent. In other words, if you are, let's say, sitting in a chair And some of the time it gives you back pain and some of the time
Mm.
it doesn't. I would be looking for a neuroplastic cause in that condition. Somebody with ankylosing spondylitis, for example, if they get pain when they're sitting in a chair, it's from the ankylosing spondylitis, it's probably going to be pretty consistent from time to time. One of my colleagues, though, tells a story about a patient who would get back pain sitting in her chair in the office at work, but she could sit in a very similar chair at home and watch March Madness basketball for hours on end, and her
Right.
back would be fine. So, that is an example of an inconsistency that supports the idea that, that was probably something stressful in her workplace. Another quick example, very simple, but this was missed by, 3 or 4 other doctors, was a gentleman who only got his pain when he was driving to work. When he was
Yeah.
driving home from work, he was fine. And there was a huge stress going on in his workplace. And the time of that stress, the duration of that stress corresponded exactly to the time of his pain.
Hmm. What you're saying, Dr. Clark, makes me think about the ways in which, on the autoimmune side of the fence, stress can lead to flare ups. And, whenever we in this community can see that we're stressing, feeling a lot of stress, we try to take some sort of initiative to undo the stress. Is that work in the same manner with neuroplasticity? Like, is it as simple for that gentleman you just described? If he had changed jobs, would it just automatically be something that would reduce it, or are there other factors that you have to account for that prevent, in order to prevent the stress from having adverse effects with your neuroplasticity?
Yeah, that's a very wise question. And that particular gentleman, when he went to his supervisor, once he found out that the connection with the stress in his job, he went to his supervisor and was able to get some changes made, and his physical symptoms improved dramatically as a result
Hmm.
of that. It's also the case with autoimmune diseases that they can flare up in response to stress. And
Hmm.
sometimes the stresses are not so obvious. That gentleman, it was pretty obvious,
Right.
going to work and where he had this big stress. But other people, their stresses are hidden, especially those with neuroplastic symptoms, especially the ones that derive from their childhood experiences. For example, many people who came through adversity as children, they responded to that adversity by trying to be perfect, by trying to be
Hmm.
the best little kids they could be, by being very critical of themselves, so much more critical of themselves than they would be of anybody else. They are focused on the needs of others in their environment, whether it's their relationship partner or their workplace or their neighbors or members of a social group. And so they're not accustomed to putting themselves on the list of people they take care of. They're kind of living on a treadmill that they never step off. Sooner or later, your body is going to protest, whether it's your immune system acting up or a neuroplastic condition acting up, or both at the same time. They both can
Right.
be triggered by this. And it's, to just make this even more complicated, there is one very solid research study that shows that the more adversity you went through as a kid, the more likely you are to experience an autoimmune condition as an adult.
Hmm.
And the theory about why that is that stress on children can activate their immune system and initiate chronic inflammation that
Wow.
can play out decades later in the form of autoimmune diseases and also heart disease and diabetes and even cancer. What we don't know is if you suffered adversity as a kid and we address those issues as an adult, will that change the course of your autoimmune condition? Will you have
Hmm.
a better outcome 10 years later than if we had not intervened for the long-term impact of autoimmune conditions? We don't know that, but
Yeah.
we absolutely do know that if we intervene successfully for the long-term impact of your ACEs, which is an abbreviation for adverse childhood experiences, if we intervene for those, we can actually alleviate neuroplastic symptoms. So these
Hmm.
people who had these symptoms for years or even decades, they can get better.
That is remarkable.
You bringing up autoimmune conditions in kids reminds me of the fact that kids are getting diagnosed with autoimmune conditions triple the rate of any other group. I
Right.
can't help but wonder if part of this has to go back to this neuroplasticity and the fact that kids are on phones more often, exposed to social media, internet bullying, just some of these factors that our older, myself included, older generations haven't had to go through. Do you see any correlation with, based on your experience, kids getting exposed to more adversity?
Yeah, there is evidence that anxiety and depression and even suicide are going up in our youthful age groups. And it's not 100% conclusive that social media and cell phones are responsible for this. There may be other factors at play that are more important. It's not an area of sociology that I'm an expert in, but it is certainly something I've observed in my own grandchildren, two of whom are teenagers, that bullying just seems to be accelerated.
Yeah.
Rumor will start, and a rumor that might have taken weeks or months to play out 20, 30 years ago, uh, it'll go throughout the entire school overnight, if not faster.
Yeah.
And that has to be adding to the stress load of adolescents today.
And along with the stress load, so we've previously talked about on this show, like the big T versus the small T's and trauma.
Mhm.
And have you seen it play out any differently when it's one severe instance versus more of a chronic stressor over time and how that manifests in patients?
Yeah, it's a great question. It was something that I had to learn early in my career, that what we call the small T traumas that don't seem to be as obviously bad as the big T traumas, those small T traumas can be every bit as impactful on someone as an adult. So many of my patients were just simply made to feel like they weren't measuring up, or they were second rate, or they were worthless. And that triggers the response in the child of trying to be the best kid they can be and trying to be perfect and being extremely critical of themselves and not asserting themselves and burying their emotions so that they're not feeling the anger, the shame, the fear, the grief, the guilt that they otherwise would. And those emotions are such an important signal to us about what's going on in the world and how it's impacting us. And so if you don't have those emotions to tell you those things, then you're likely to make choices that are not good for you. But it all adds up to these very similar impacts on people, and leads to the same kinds of physical responses in the body, which can be migraines or ringing in the ears or visual disturbances, fibromyalgia, irritable bowel, chronic fatigue, symptoms that sometimes get blamed on chronic Lyme, which really doesn't exist, certain kinds of rashes. These are all very real symptoms. And if you happen to have them at the same time as an autoimmune condition, it can be really challenging for physicians to sort out what's going on.
Mhm. We're talking about internet culture and bullying and things that can be really like universal experiences throughout a generation. But I'm curious, Doc, in the ways you've seen food insecurity and sort of the stresses that come from poverty affect neuroplasticity, like just the ways in which that sort of like instability that poverty can provide. How does that shown? Is there like a higher correlation of those who've pardon me, lived with certain socioeconomic disadvantages who have shown up with these neuroplasticity issues?
Yes, that's another excellent point. These can add to all of the stresses that I was mentioning earlier. Poverty, or if you live in a dangerous neighborhood where there's violence is around you, even if it's not in your home. Additional areas of stress that can contribute to the others are, if you've been subject to racism or harassment because you're in some way different. If you're
Hmm.
LGBTQ, if you're
Hmm.
neurodivergent, if you are a follower of a religion that is not common in your community, if you are a large person,
Yeah,
larger
yeah.
than your peers, so you can come in for bullying for that reason. So any kind of difference, anything that makes you stand out in your community as different, can trigger bullying of you by those around you, and that like I say, that adds to the sources of stress from everything else.
As patients, a lot of us in our community are familiar walking into a doctor's office and listing off a laundry list of all these random symptoms that are happening. How can we help our physicians sort all this out? What can we do to help advocate for our situations physically, mentally, to get the help that we need if we need it?
Yeah, my organization, the Association for the Treatment of Neuroplastic Symptoms, is trying to educate healthcare professionals, both medical and mental health, how to assess people for neuroplastic symptoms as opposed to symptoms caused by organ disease or structural damage. At the moment, it's only a very tiny number of medical clinicians in particular that have had the formal training to do this reliably. So we often refer people who have questions about this to our symptomatic.me website, where we have a 12-question screening quiz, a self-assessment quiz. It's designed so that the more questions to which you answer yes, the more likely it is that there's a neuroplastic origin to your symptoms. And then we can go from there and assess people for in your life right now, traumas that you may have been through, adversity in childhood, emotions that you're having that you're maybe not fully in touch with that are getting expressed into your body. And when people can identify these things and start working on them, there's usually effective treatment available, whether it's from books or apps or the courses that we have on the website. We've got a directory of practitioners that are highly knowledgeable in this field. But by working on these issues, if you start to see improvement in your symptoms, that's very solid evidence that they are neuroplastic in origin. If you've got a symptom that's 100% from lupus, for example, you can work on your stress all day long. It's probably not going to help that symptom. But if you work on the stress issues and let's say the pain from your rheumatoid arthritis improves by 80%, that tells you that you've had a significant contribution to your arthritis pain from a brain to body condition.
That's incredible, just the relatability between the two and the fact that you are sorting out the differentiation of how this is manifesting in the body.
Yeah, it's remarkable how absolutely real these things are. I mean, pain is pain. It is always real. People are not imagining it. Another concept that comes as a surprise to some people is that pain is actually generated in the brain. When you have arthritis, you are not getting a pain signal from your joints, you are getting a damage signal from your joints. And it goes up to the brain, and the brain decides, you know what, we better give you a pain signal in these joints because we want you to be careful about those joints and not damage them further. But the brain, under certain circumstances, will also decide, hey, we're not going to give you a pain signal, even though there is damage. And an example of that would be if you are running from a predator and you sprain your ankle. Your brain is going to decide, not a good time for me to give you a pain signal. We're going to wait until you reach safety. Then you can feel the pain. But for right now, you got to run. And it can also do the opposite. It can create pain where there is no bodily damage. Just because of the information that it's receiving, it can make mistakes or it can get confused. Classic example is a photograph published in the British Medical Journal about 30 years ago of a construction worker who impaled his boot on a nail. And the pain was just agonizing for him. He was rushed to the emergency room, given morphine intravenously, and then the boot was carefully cut away, only to reveal that the nail had passed neatly between his toes. Didn't have a scratch. But because of the information that his brain was receiving, it generated a pain signal, even when there was no tissue damage. So it just shows you what the brain is capable of.
The brain is so powerful. Just like
More so than I was taught. I went through 7 years of very good medical education, and nobody mentioned these kinds of things. It shocked me, but I was skeptical at first. But I have to say, after 7,000 patients, I'm not a skeptic anymore.
What can be done on the preventative side? Like I think about the elders in my life who they say they're playing Sudoku to try to like stave off Alzheimer's and all these other like dementia related things. Is there anything we can do on the preventive side of neuroplasticity to keep our brain from being able to process pain in this way that could severely impede our lives? Is there anything we can do?
Well, we definitely want our brains to be doing this because it's a form of communication.
Mm,
When we are experiencing neuroplastic symptoms, it is our brain trying to tell us that it is in a state of distress. And for whatever reason, it is not able to communicate with us about this distress in a cognitive way or in a
yeah,
verbal way.
yeah.
So, what we want to try to prevent this is we want to be in touch with our emotions. We want to be aware when we are in a state of distress. And that oftentimes means unlearning assumptions that we gathered when we were kids. So
Mhm,
if we grew up in an environment where we were made to feel like second-rate human beings, where we learned that it's our job in life to take care of everybody else in the world,
mhm,
where we learned that it's a better way to handle emotions, um, to bury them rather than to feel them.
yeah,
We need to unlearn those things. And we
yeah.
can unlearn those things. The new neuroplastic recovery therapies are highly effective,
Mhm,
and they help us to change these false assumptions that we may have acquired early in life. And the
mhm.
research on this now from across North America, Halifax, Boston, Detroit, Boulder, Colorado, UCLA, the just dramatic outcomes from gold standard research using trial groups with the neuroplastic recovery therapies and control groups of various types, and the improvement using these new treatments compared to the control groups is just off the charts. The Boulder back pain study, they took people who'd had chronic back pain for an average of a decade, and in 4 weeks, they brought the pain levels down by 75%.
Whoa.
That's incredible to me because, especially with some of these big T traumas that can happen early on in our life, that people can see result as quick as 4 weeks when these could be essentially lifelong issues.
Right.
Yeah, no, my patient, 87-year-old woman with unexplained abdominal pains since she was 8 years old. They were almost gone after about four months. Another patient of mine had abdominal pains for 55 years. You talk about the expense of this. Volume 3 of his paper chart was 3 inches thick, full of diagnostic tests and unsuccessful treatment trials. He was a physical abuse survivor. I sent him to a class with other people who had survived abuse, led by a very thoughtful and sensitive instructor. And after a few weeks, he trusted the group enough to share his story, and just putting it out there, putting it into words with this supportive and understanding group. First time he'd ever done this, his pain went away too.
Wow. It sounds miraculous. I mean,
It
I
does.
can't I
Yeah,
can't
well, there is another end of the spectrum. I have some patients that need years of psychotherapy to
Sure,
achieve the same kinds of outcomes. There's no question
sure.
about that. But of course, being a physician, I love telling the stories of people who had dramatic turnarounds.
Yeah.
My first book on this is called "They Can't Find Anything Wrong." The first story in
Mhm.
that book is a patient who was hospitalized 60 times at a major university with no diagnosis for her attacks of severe dizziness and vomiting. But
Whoa.
it turned out all of the attacks were triggered by encounters with her abusive mother. And
Wow.
as soon as she saw the connection, and it was still going on, she's 50 years old, and when she had encounters with this mother, an attack would get triggered.
Yeah,
And she didn't see the connection because the emotions around this are so buried,
for sure.
that she was not consciously aware. but her brain was aware, and it was, trying to express its distress by
Yeah.
making her, so dizzy she could hardly stand up, and made her throw up, and she'd be in the hospital for up to 4 days. But as soon as she saw this connection, she just had this light bulb moment, and she looked up at the ceiling. I can still see her doing this, and said, "Oh my God, I can't believe it." And she
Mhm.
was cured on the spot. She
Wow.
had seen a dozen specialists, um, and including a psychiatrist, and
Mhm.
they all missed it. They all missed it. 15 years she had been getting hospitalized.
Yeah. Where do you see the um things in research that are exciting to you regarding neuroplasticity, and where do you see the research gaps where you're like, we need funding for this? There's still such a gray area here. Like, what are those extremes of what you're excited about with research and where you still see a need?
Yeah, the most exciting research that's happening right now is where they are comparing the new methods with cognitive behavioral therapy. Cognitive behavioral therapy, as you may know, is the most dominant form of psychotherapy in the United States. It's
Hmm.
everywhere. It's probably, 80% of psychotherapy is CBT, as it's called. And that's the previous gold standard. And the results using it for chronic pain have been extremely disappointing. And it's because it doesn't really get into the root causes. It doesn't get
Hmm.
into the adverse childhood experiences and the emotions. And it doesn't really have a goal of relieving your pain. It's more
Yeah.
about helping you live with it. So the we're starting to see the research that is comparing the new treatment with, the emotions and the ACEs, and the goal of relief compared with CBT. And there are a number of studies going on right now where that's being done. The one that's my favorite that's been published is the UCLA study, and they looked at a very tough group, older male veterans, very diverse in terms of their ethnic backgrounds.
Yeah.
Average age in the 70s. So,
Mm.
you're not going to get away with any psychobabble with
No.
this bunch.
No.
Um, so half of them got emotional awareness and expression therapy, which is one of the
Uh-huh.
new types of neuroplastic recovery therapies. And the other half got CBT. And their goal was to get at least 30% pain relief from these people who had musculoskeletal pains of various kinds.
Hmm.
And in the CBT group, about 17%, which is, about what they usually see with CBT, about 17% got to the 30% pain relief.
Hmm.
But in the NRT group, the new form of treatment, 63% got to the goal for pain
Yeah.
relief. So it was almost quadruple the amount of relief that they achieved. Just
Hmm.
in the previous years, decades of research into this, you never saw um, an outcome like that in the research, that you would get almost 4 times better results with one form of talk therapy compared to another. It just didn't happen. This is truly a revolution or a paradigm shift, and there's more research underway at the moment, trying to replicate this, and I'm
Hmm.
fully confident that they will.
That's awesome.
Incredible that you're making such headway. Dr. Clarke, can you share for people who want to learn more where they can go to get more resources?
Yeah, the Association for the Treatment of Neuroplastic Symptoms, the neuroplastic term is new, but we like it because neuro means brain and nervous system, and plastic is actually very hopeful because it means a capacity for change in medical jargon.
Hmm.
And we've been around since 2011. We have all kinds of resources. We have an annual conference. We just had it September of 2025. 350 people came from all over the world, everywhere from New Zealand to Israel. We're having our next one in mid-October of 2026. It's going to be in Dallas, Texas. We've got recorded courses, some of which are aimed at professionals, but we deliberately made them jargon free
Hmm.
so that even people who are not healthcare professionals can fully understand them. We have books that we've written with multiple authors. My own book, They Can't Find Anything Wrong. We have lots of videos. My own podcast is called The Story Behind the Symptoms, where I interview patients much as I did in my own office and talk to them about every kind of stress that might be responsible for their condition. Two of my colleagues do one called The Science Behind the Symptoms, where they talk about the research that's behind all this. And we're starting a new one in January called The Solution to the Symptoms, where a psychotherapist who does this work interviews a patient and has expert commentators involved in it as well.
Mhm.
So lots and lots of different resources on there that I dearly wish I had had access to when I started in practice
For
40 years
sure.
ago.
For sure.
But it's just the recognition of this is just exploding because of the clinical effectiveness.
Mhm.
I have to say thank you for your very important work. This is
Oh, yeah.
unbelievable breakthroughs, and you're making incredible progress for patients all over. So, first, thank you for that.
Yes.
Thank you, Karen. I appreciate it. And again, I think people with autoimmune diseases, they can, at the very least, screen themselves for these other conditions.
Mhm.
Just because you have an autoimmune condition doesn't mean you can't also have a neuroplastic condition at the same time. And the screening test can help people assess themselves for that.
Yeah, and I want to add on to that. A lot of times these diseases get triggered from stressful events. So I think it's very much worth checking out that assessment and just seeing.
Yeah,
Absolutely.
it's one of the wonderful things about treating this condition is that not only do we alleviate physical pain and illness, but it changes people's lives. Their ability to um, identify and manage the stresses in their lives, set boundaries around them, um, choose different relationship partners, make changes in their workplace, insist on um, their lives being different in their homes and elsewhere. It's really dramatic, the ripple effects elsewhere in a person's life.
Well, I think it gives them the platform to take control of some areas of their life that they probably previously didn't think that they had much control. There's something else going on behind the scenes.
Yeah,
Mhm.
and it changes people's self-image as well. Many people who came out of adverse environment as kids who were made to feel like they weren't measuring up, they can instead recognize that that experience happened through no fault of their own, that it was
Right.
like being parachuted into a dangerous jungle as a toddler,
Mm.
and they had to find their way out. And the
Yeah.
fact that they did find their way out is deserves tremendous credit. Let's put it that
Yeah.
way.
Yeah.
It's the epitome of resilience that we often talk about on this show.
No doubt.
Yeah, most definitely. And one of the most useful exercises that I have my patients do in that regard is to imagine their own child growing up exactly as they did. And if you
Ah,
imagine that, oftentimes you can recognize much more accurately how much you had to put up with.
yeah.
When people look back at their own lives, we don't have anything to compare it with. So oftentimes I'll hear people say, "Oh, it wasn't that bad," or they'll say, "Other people have been through worse."
Mhm.
But if they imagine their own kid going through, or a child that they care about going through the same thing, you see their facial expressions change when they start thinking about that. And you know, many of them are horrified, and they'll just
Yeah.
say, "Oh, no way would I let my kid be in that environment even for a day." And it helps them to see that they truly had heroic levels of perseverance to make it through. And they can give themselves credit for that. They can internalize that recognition of their own strength.
Well said. Dr. Clark, thank you for being here. Thank you for being here, Chris, as always. Just wonderful information, Dr. Clark. Thank you very much. And to our community, we'll be sure to put those resources in the description. Until next time. Take care. Peace.
Peace.